Hello, ma'am. Good morning.
Good morning, ma'am.
Shall we start now?
The best preparation for tomorrow is doing your best today. So concentrate on this day and make it the best ever. A pleasant morning to one and all present here. Myself, Asma of 2nd MSW and Kritika of 1st MSW are happy to host this webinar. A small cheers and a great welcome makes a merry. A hearty welcome to everyone for the webinar on account of observing International Day for Persons with Disabilities on the theme Observing Child with Disabilities and Overflow.
Music is the only language in which you cannot say a mean or a sarcastic thing said by John Erickson. Now I request Ms. Pavitra Sangavi, Keertana S, Keertana M to sing a department song.
எங்கள் கல்லூரி வைஷ்ணவ கல்லூரி சமுதாயம் மாற்றம் காண உழைக்கும் கல்லூரி இது எங்கள் கல்லூரி வைஷ்ணவ கல்லூரி சமுதாயம் மாற்றம் காண உழைக்கும் கல்லூரி வீழ்ந்து கிடக்கும் ஏழைகளின் துணையாயிருப்போமே வீழ செய்யும் விஷமங்களை தூக்கி எறிவோமே வீழ்ந்து கிடக்கும் ஏழைகளின் துணையாயிருப்போமே வீழ செய்யும் விஷமங்களை தூக்கி எறிவோமே சமூகமே எங்கள் இரண்டாம் முகமே சமூக சீர்கேட்டை முனைத்தோமே வழிமாறி போகின்ற மனிதரின் வாழ்வில் வழிகாட்டும் மாதவனாய் இருந்திடுவோமே இது எங்கள் கல்லூரி வைஷ்ணவ கல்லூரி சமுதாயம் மாற்றம் காண உழைக்கும் கல்லூரி வறுமை வாட்டும் நெஞ்சங்களில் பலமை சேர்க்க வந்தோமே நலமான வாழ்க்கை வாழ மருத்துவங்கள் செய்வோமே கல்வி என்னும் செல்வம் அதை வீடு சென்று தருவோமே கரையின்றி என்போரின் விதி மாற்ற வேண்டுமே குழந்தை பெண்கள் இளையோரின் உரிமை காக்க விரைந்தோமே விதைகள் எங்கும் தூவிய பசுமை உலகம் படைத்தோமே சமூகமே எங்கள் இரண்டாம் முகமே சமூக சீர்கேட்டை சீர் செய்ய முளைத்தோமே வழிமாறி போகின்ற மனிதரின் வாழ்வில் வழிகாட்டும் மாதவனாய் இருந்திடுவோமே இது எங்கள் கல்லூரி வைஷ்ணவ கல்லூரி சமுதாயம் மாற்றம் காண உழைக்கும் கல்லூரி இது எங்கள் கல்லூரி வைஷ்ணவ கல்லூரி சமுதாயம் மாற்றம் காண உழைக்கும் கல்லூரி
Thank you, girls. Now, I would like to call upon our respected Mrs. F. Esther Winsley, ma'am, head in charge, to welcome the gathering.
Good morning, everyone. On behalf of the Department of Social Work, I welcome everyone for this webinar on children with disabilities and overview. It is my privilege to welcome our eminent resource person, Dr. Rachel Ma'am, Assistant Professor, Department of Social Work, Madras School of Social Work, IGNOR. We welcome you, ma'am, and we are eagerly waiting for your meaningful inputs, ma'am. I extend my welcome to my colleagues who share their knowledge and skills in the upliftment of our department, Mrs. Helen, Mrs. Aruna, and Ms. Priyadarshini. I welcome our enthusiastic and vibrant social work students and other students from other departments for this webinar. The number of children with disabilities globally is estimated at most 240 million, according to a new UNICEF report, November 2021. Children with disabilities are disadvantaged compared to children without disabilities. They face multiple and often compounding challenges in realizing their rights. So it is important for the youth to understand the rights of the children and their needs. I assure that this webinar will give you good insights about children with disabilities and role of youth towards the development of the kids with special needs. Once again, I welcome you all. Thank you.
Thank you, ma'am. I would like to call Ms. Pavitra of First MSW to present the video. Thank you, Pavitra. Now, I would like to call Ms. Reshma of 2nd MSW to read the profile of our eminent resource person of the day, Dr. S. Rachel.
Good morning to one and all present here. I'm honored to welcome our beloved resource person, Dr. S. Rachel, Assistant Professor, Department of Social Work in Madras School of Social Work. She has got 8 years of teaching experience in the field of mental health, community health, and 3.5 years of working experience in the field of health. She has received ICSSR Doctoral Research Fellowship. She has completed her PG in social work, specializing in medical and psychiatry from Stella Maris College, Chennai. She has conducted various training programs, sensitization programs, and workshops on gender and women's rights, drug abuse, research methodology in many prestigious educational institutions for students and faculty members. She has published more than 16 papers in various national and international journals, mainly focusing on health. She was a part of departmental extension research project. Presently, she is principal investigator for a project titled Correctional Administration Issues and Remedies in Rehabilitation of Inmates, funded by State Child Protection Society, Department of Social Defense, Tamil Nadu. We heartfully welcome you, ma'am.
So good morning, everyone. Am I audible? Yeah. Okay, thank you for that. Thank you, Reshma, for your kind introduction. We all know India is a home to 18% of world's children, of which 40% of India's children are in need of care and protection. And also, we also know that which ma'am had also told, that 240 million of children globally are affected from one or other forms of disability. At this juncture, I would like to thank and congratulate the management, Dr. Geeta, the principal, Dr. Ms. S. Lekha, the Vice Principal of Day Section, Dr. Sita Lakshmi, Vice Principal of Self-Finance Section, Professor Esther Vinci, Head of the Department of PG, Department of Social Work, the organizers, faculty members and students, Department of Social Work, and other department faculty members and students of SDNB Vaishnav College in joining hands in the mission of prevention of any forms of disabilities. And let me just share my screen. Is my screen visible?
Yes, ma'am.
Oh, okay. So as we all know, this day is International Day of Persons with Disability, which is observed on 3rd December. And you know why and what is the main reason for this observance? The main reason of the observance of this International Day of Persons with Disabilities is aimed to promote an understanding of disability issues and mobilize support for the dignity, the rights and well-being of the persons with disabilities. Okay, so before we move on to my slides, I would I want everyone's cooperation in this. 2 minutes or like even a minute, or you can just think from the way from your house to your college. Okay, you're passing through various places, right? So in that sector, I just want you to recollect, are these places very much disabled friendly? If it is yes, I want your response in the chat box. If it is no, you can just put no. Take time. Just recall your place from where you come to your college, not more than that. So I would like you to respond me saying that whether it is all disabled friendly or no. Okay. Is it disabled friendly? Okay. 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 I'm not talking about your college, but your pathway from your house to your college, the roads, the transport facilities. Yeah. Okay. I'm getting text from, yeah. Okay. From this, we could clearly understand that most of the plays are not disabled friendly, right? So this is the high time for us to understand how important is to understand the problems of these people who are with special needs, and how are we going to mobilize our support for their dignity and their rights, and so that like definitely we will be able to focus on their well-being, right? So this is my the overview of my presentation will be like this. The flow, I would like to introduce you on certain topics as such, and then I will move on to certain definitions which you would definitely would like to have to know, and types of disability, their concerns, and what would be our responsibilities, right? So we all know that we often have heard the terminologies saying that disability, they are all disabled people, they are differently able, they are in need of special needs, okay, and they are people with some impairment, and they are handicapped people. All these terms are always like coming and going, right? So what is the main difference between these three components as such? So when we say impairment, it is nothing but a missing or of any defective parts of the body. It can be an amputated limb, the paralysis, or like which will not, it can also be mental retardation. Just a minute. Or all these impairments will not be resulting or will not be really very much effective in providing a kind of very friendly environment for the people with disabilities, right? So as a result of this impairment, many of them will definitely might have, because of their disability, they might be feeling very difficult in walking, in seeing, in speaking, sometimes hearing and reading, and it all depends upon what kind of disabilities they are affected with. It can be temporary, or like it can be temporary total disability, or it can be temporary partial disability, and sometimes it can be also a permanent disability, not helping them to do their activity. Disability becomes a handicap when it interferes with the daily activities of any person who what they are expected to do it, right? So this is the main difference which we all have to know before we move on into the aspects of other disabilities. We all know that the recent legislation has been passed, that is the rights of the persons with disabilities. It has in the year 2017, it has listed around 21 disabilities. So as I had told you in my previous slides, that I'm going to talk to you on the main aspects, like what exactly is the word disability means, and what are all the different types of disability, and what are all different concerns. Yes, ma'am.
Ma'am, slides are not moving, ma'am.
Sorry. Ma'am? Yes, ma'am. Sorry.
Ma'am,
You're not?
you can see only the first slide. Yes, ma'am.
Okay, just a minute. Is it okay now?
Yes, ma'am. Yes, perfect.
Okay. Thank you, ma'am. So this physical disability, they had categorized these 21 different types of disabilities, and we will see one by one. And I'm not going to give you a lot of or pressurize you a lot on the information, but why this session for you is what you have to understand first. A study had already had mentioned saying that 75% or like almost all the disabilities can be prevented. It is not prevented. You know why? It's all because of lack of awareness. So now this institution of your college had taken this effort of educating you so that you will be one among the person, an instrument in stopping or preventing any forms of disability in the community. Uh, um, Statistics reveals that out of the 121 crore population in India, 2%, that is, people are affected with one or the other forms of disability. Children are affected with some forms of physical disability, whereas youngsters are affected with mental illness, whereas elderly people or senior citizens are affected with impairments with related to the visual impairment or hearing impairment and so on. So now we will just see the list that is enlisted by the Act 2017, the rights of persons with disabilities. So the number one is the locomotor disability, the visual impairment, hearing impairment, and so on, under which we will see one by one how they are defined and what are some of the symptoms which they are talking on. Okay. Are you able to see the slide now? Yeah. Okay, so the first form of disability is blindness. This is a condition where a person will suffer from any of the following conditions, such as there might not be any sight, where they will not be able to see at all, and also sometimes they might also have a limitation in their field of vision, and it can also be a person with low vision, where which a person with impairment of visual functioning even after treatment. And the next type of disability is all about cerebral palsy. It is a group of non-progressive conditions where which there is an abnormal motor control. This can be the result of a brain injury or a brain insult, which can be during the pregnancy or delivery, or like even in the neonatal aspect of the child as such. Next type of disability is the hearing impairment. Here there is a loss of 60 decibels or more than, where which a person will not be able to hear what they are supposed to hear. The next type of disability which is enlisted is the leprosy cured person, and a person who has been cured of leprosy but still after this Hansen's disease, otherwise called as, so there will be a kind of a loss of sensation in the hands or feet where which was affected part, which will definitely will be affecting their movements as such, their everyday activities. Next comes your locomotor disability. This disability is the disability of the bones or joints or muscles, which will definitely will not be able, will not help a person to move. All right. Now, this can be a result of the any injuries in the spinal cord or head or soft tissues or fractures, even muscular dystrophies, and so on. Now comes the mental illness. This mental illness is nothing but any mental disorders other than mental retardation, which means that there is a kind of a chemical imbalance in the brain functions, okay, in the neurotransmitters, which will result a permanent disability in the person's life. Next comes your mental retardation, a condition of arrested or incomplete of development of mind of a person, which will definitely is going to have an effect in their cognition, that is the thinking aspect, their language, the motor, and their social abilities. Now we also have watched a video on autism. This is a condition of uneven skill development, where which it affects the primarily the communication and social abilities of a person, where which you will be able to see in such kind of people repetitive and ritualistic behavior. We will see all these aspects in detail in the upcoming slides as well. So next comes the multiple disability. This is a combination of two or more disabilities, and it is also well defined. It can be a combination of hearing with visual impairment or any other impairments together. Next comes your learning disabilities. You might have come across such kind of people even in your college, in your class, and so on. This type of disability will affect the person's ability to acquire, process, or either in forms of the writing or talking or like in their actions. So there are different types of learning disabilities or dyslexia. So one of which is known as dyspraxia. It is the inability to motor plan. That is like you will not be able to move as such. Dysgraphia is the difficulty where which an individual will not have a efficiency in writing. Okay, they will not be able. They might also have difficulty with regard to spelling. The next comes the dyscalculia, where which the person will have this difficulty in calculations. And there is also another disability which is otherwise called as attention deficit and hyperactivity disorder, where which there is a kind of a distraction, okay, in the person's concentration always. And these people will not, these children particularly, will not be able to settle in one place as such. They will be continuously moving. Next comes your intellectual disability. This is also otherwise called people with intellectual disabilities, where which they will have a specific learning disability. As we had seen in the previous slide, they might not be able to write, they might not be able to draw, or they might not be able to calculate, and so on. And autism specific disorder also comes under intellectual disability because it affects their thinking pattern as such. And there are disabilities that are caused due to chronic neurological conditions such as multiple sclerosis and Parkinson's disease, where which these people will have their difficulties in their movements, in the neurological movements as such, because of the conditions, because of the neurological aspects. And there are also blood disorders, hemophilia, thalassemia, sickle cell disease, which all affects. We all know that hemoglobin is the main aspect in our blood, right? It is a kind of a protein aspect which is responsible for the circulation of the blood, right? So all these people with such kind of disorders will not be able to have a kind of a problem where they will have a problem where which the circulation is not perfect. They will have problems in clotting of blood, and their red blood corpuscles will be in sickle cell disease in the form of a sickle type, where which like because of the deformation, the everyday aspects, the aerial, that is the activities of daily life of all these individuals will be completely in a very devastating aspects. And as I had told you, multiple disabilities, it is nothing but a combination of one or two disabilities. And acid attack victims also is enlisted as one among the disability in this act as such, where which a person after being a victim of an acid attack, there also, because of the deformation and because of all the negative aspect, they might not be able to lead a very happy life or like a very normal life as before. So they are also considered as disabled people. And comes next this Parkinson's disease, which I had told you. This generally affects the people in their later stage of life because of the neurological problems. Next comes the mental behavior, and that we will see in detail as such. So now I would like to focus mainly on the children. All these acid attack victims or Parkinson's disease, all these might happen in any course of time, but particularly it focuses on the people in their later stage, that is the young or adulthood stage. Now our concentration today is on children. So now I would like to focus on the various aspects, how these children are affected with one or other form of disability, which are many a times or mostly are preventable. So here are disorders. Number one is the mental retardation. Number two is a specific developmental disorders. Next comes your pervasive developmental disorders, hyperkinetic disorders, conduct disorders, tic disorders, enuresis and encopresis, speech disorders, habit disorders, and other disorders. And in the upcoming slides, we will see what are these and what are the symptoms of these children as such. When coming to mental retardation, so mental retardation is defined as significantly significantly sub-average of general intellectual functioning associated with significant deficit or impairment in their adaptive functioning. So this occurs and this is actually manifested before the age of 18. Okay, so where which a person, okay, with mental retardation may not be able to function as efficient or as significant as any other person because of the retardation or the stop of the growth of the brain as such. There are grades of IQ, that is how the IQ level of each individual, a person, okay, is considered to be really very genius if the calculation is 140 plus. A person is said to be very superior in intelligence when they have 120 to 140 score of IQ, and is considered to be superior intelligent when their score is between 110 to 119, and they are considered to be normal or average intelligent when their score of IQ level is 90 to 109, and they are considered to be dull if the score is 80 to 89, and 70 to 79 score is called as borderline deficiency, and people who are like children with the score lesser than 70 are considered as indefinite feeble-minded people. Okay, so according to this IQ test, we can classify the mental retardation as below. People who had scored below 20 is found to be profound mental retarded people. I could see people had raised hand. Is there any concern? Or can I move on? Okay. So the people with profound mental retardation are found to be having IQ with level below 20, which means that they will not be able to train in any way, right? So they'll be there like kind of a vegetable where which they will not be able to work. So taking care of them is the primary aspect as such. Now coming to severe mental retardation and moderate mental retardation, there are aspects where which we can train them with respect to their toilet training, their everyday activities like eating, okay, maybe a kind of a dressing. All those aspects is trainable, but not comparatively as like mild and borderline intellectual functioning. So this mild mental retardation will be able to function far better better than the previous said people. And finally, this borderline intellectual functioning people are found to have IQ score between 70 to 84, which means that they will be able to do aspects, and they are very much educationable also, and they will be able to function to the maximum optimal level. So that is why we always have this mainstreaming of schools like inclusive education, where which a school will have a normal kid and also kids with a lower or like moderate level of IQ. So all they are, by seeing their peers, they will be able to develop on their own. Okay, so that is there. So what would be the causes of these children affected with mental retardation? Okay, so there are 6 causes which has been explained in the short book by Neeraj Ahuja. Number 1 is Down syndrome. Number 2 is phenylketonuria, criticism, cranial anomalies, microcephaly, and hydrocephalus. So we will see one by one. So Down syndrome is nothing but a chromosomal condition characterized by the presence of an extra copy of genetic material on the 21st chromosome, right? And this incidence is estimated at 1 per 733 births, although it is more commonly with older parents, maybe because of their age. Children are born like this, and other factors may be consanguineous marriage, that is the marrying the relatives is also a reason for children being born with such syndrome, that is Down syndrome. Um, so this Down syndrome is associated with some impairment of cognitive ability and physical growth and a particular set of facial characteristics. Now, these children who are born with Down syndrome tend to have a lower than average cognitive ability, and they are found to have mild to moderate level of disabilities. You would have seen children like this, right, in your schools or colleges. And the average IQ of these children is around 50, which is very much compared where which a normal child will have an IQ of 100. A very small number of children also said to have a severe or high degree of intellectual disability. Next comes your phenylketonuria. This condition is because of an amino acid. The baby during the birth will be really very normal, but what happens is like after the birth, like there is a lack of an enzyme which is known as phenylalanine, an amino acid found in the protein foods. So when this enzyme's work is to break down this amino acid in the protein foods, but this enzyme is, if it is not found, this phenylalanine will be built up in the blood, and definitely this leads to brain damage. So definitely we have to be really very careful about how the condition of the children are, as such the babies. So this disorder, how will we know that definitely this is exhibit in this children, or like how will we identify? The main disorder, the main aspect is that the disorder usually becomes apparent between 6 to 12 months after the birth. Although such symptoms such as vomiting or peculiar odor from the child, infantile eczema, that is a skin disorder, the seizures, that is the fits, may also become very much apparent during the early weeks of life. All these would be the symptoms for us to identify or to screen whether these children are affected with phenylketonuria. Often the first symptoms noticed are signs of mental retardation, and there will not be much motor coordination in these children. And these children, if they are found not treated, their eyes, skin, and hair of these children are found to be really very much pale. And this phenylketonuria is thought to result from metabolic alteration because of the recessive genes, and 1% in 70 is thought to be a carrier. Next comes your criticalism, which is a thyroid deficiency found in children. So criticalism provides a dramatic illustration of our mental retardation, where which there is an imbalance in the endocrine. In this condition, the thyroid either has failed to develop properly, or it would have underwent some kind of a degeneration or injury. So whatever might be the reason, the infant suffers from deficiency in thyroid secretion, which will result in mental retardation as such. Typical description of the cretins involves cases in which the people will have thyroid deficiency, and the children with this kind of issues would have a physical conditions like dwarf-like, that is a shortened structure, thick-set body, and short stubby extremities, that is like their hands and that is, the fingers and the toes will not be as long as it is not with the normal people, whereas it will be very stub, it will be a very short end. So they will not be growing beyond 3 feet, and they might also will have a kind of an exhibition of bent legs and a curvature of the spine as such. And a person with such a problem, their head is found to be really very large in size, and wiry hair, and also will have some physical symptoms like kind of a broad flat nose, flappy ears, and also they might not be very much matured enough with regard to sexual activities. Uh, they will also have a very blanded personalities, and they will fall with severe on to moderate categories of mental retardation depending on the extent of brain damage. Now comes this cranial anomalies. So mental retardation is associated with a number of conditions. So here cranial is nothing but the size of your head, as that is otherwise called as the crown of your body, right? So here it can be either macrocephaly or microcephaly and hydrocephaly. So macrocephaly is nothing but larger headedness. There is an increase in the size and weight of the brain, the enlargement of the skull, and which is also characterized with the visual impairment, convulsions, where which there is a problem in the brain tissues. There are also other cranial anomalies, which is otherwise called as microcephaly, which is micro, we all know that is small. Cephalus means the headedness. So it is a small head. It refers to a type of mental retardation resulting from impaired development of the brain, which is a consequent failure of the cranium to attain the normal size. So when we visit the neurologist, they will definitely, when a child is taken for examination, the neurologist will have a tape, right? So they will just measure the circumference of the head. So these children will, their circumference, the baby's head circumference generally will not exceed 17 inches, which is very much small, lesser comparative to the normal size head, which is 22 inches. And they are also found to have moderate, severe, and profound categories of mental retardation, and they exhibit difficulties in terms of language disability, language development, and they are also limited in mental capacity, that is thinking aspect. Hydrocephalus is also a condition, but it is found rarely. There is an abnormal amount of accumulation of cerebrospinal fluid within the cranium, causing a damage to the brain tissues and also enlargement of the cranium. So in congenital cases of hydrocephalus, the head would be really very much large in size and begins to enlarge, and definitely because of the circulation of the cerebrospinal fluid. So this disorder can also develop in infancy or early childhood, and following development of the brain tumor, clot in the brain covering, or infection in the brain covering, and so on. So this condition will result from a blockage of the cerebrospinal pathways and accumulation of the fluid in the brain areas as such. The clinical The clinical picture of hydrocephalus depends on the extent of the neurological damage, and while the expansion will definitely cause the destructive pressure on the brain, which will definitely cause an intellectual impairment in the kids, and there will also chances of losing their sight and hearing as such. Now I'm going on to the next type of developmental disorders that are very much prevalent among the children. So when we say developmental disorders, there are certain specific developmental disorders, and as we had seen, a mental retardation is a generalized impairment which affects all areas of functioning. In contrast, specific developmental disorders are characterized by an inadequate development in one or some other areas of functioning of a child as such. So it can affect either reading aspect, that is known as the dyslexia, the language, dysphasia, arithmetics or mathematics, where which the kids will be very much finding difficulty in calculation, that is known as dyscalculia, or like articulation. They might not be able to find, or they might not be able to articulate or put their ideas into words. They might have so many ideas, but still that will not be possible to put in word format. That is known as dyslalia. So there are also other types of developmental disorders that are very much prevalent among children, that is known as pervasive developmental disorder. This term has been variously described as autistic disorder, childhood autism, childhood psychosis, and pseudo-defective psychosis. So I would like to focus more on autism. So what is the autism, and what is the clinical features of children who are suffering from autism? So these children have some kind of marked impairment in reciprocating, okay, the social and interpersonal interaction, where which like whatever we communicate to those children, they might not be in a position to reciprocate. If I say hi, good morning, they might not be able to talk back or like reciprocate, like they will not say good morning. Okay, so that is there. So there are around 205 participants. Let's see like how much are you all reciprocating. So good morning, dear students.
Good morning, ma'am.
Okay, thank you, Subhashri. So others have all muted their videos and audios. I hope it is not this kind of impairment. So I want you all to know this is very important topic because you are all young generation. You are all the future mothers, the future educators in different aspects, different professions as such, in different positions. Unless and otherwise you know all these aspects, you will not be able to identify and help those people as such. So I invite you all to focus on to the session as such. So these autistic children will not have a social smile. They will be in their own world. They will not reciprocate because of that condition. They will not have eye-to-eye contact. They will not have awareness of where they are as such, because they will not be kind of reciprocating, because of which whatever we talk to them, they sometimes they answer back, sometimes they may not know, they might not. Okay, so there are no or abnormal social play, so they always prefer to be alone, these autistic kids, and they do not have that much of attachments to even their parents as such. Okay, and they always prefer to be alone all the time. They have their own ideas, they have their own creativity, and studies have also found out these children are found to be very creative. Okay, and they will not have the habit of imitative behavior. See, sometimes like you would have seen people, when I ask who's your role model, you might be having so many people in your mind, right? So you might you would have observed their behaviors, their movements, and many a times we will also imitate, right? So their gestures, their hairstyles, their way of dressing, their way of talking, and so on. But these children will not be in a position to imitate the behaviors of others. Whatever they know or whatever they want to know, they will know. So, and there is a absolute absence of fear of danger. So because they don't have the reciprocation of the interaction, so they are many times are found to be not aware of danger that is in front of them. And there are exhibitions saying that marked impairment in language and non-verbal communication, and because of that they lack verbal or facial responses to the sounds or the voices. So in infancy, they are like there will be like of blabbering. You would have seen babies, right? They will be in the world and they'll be talking on their own, right? These kids will have this absence of communicative sounds. There are many times there is an absence or a delayed speech among these kids. The rote memory is usually good. That is the habitual repetition of aspects. Okay, so for instance, if they like one music, these kids are generally found to be very fond of music and songs. So their memory is very much good in that aspect. And abstract thinking, how will I, and what is a summarizing of this aspect, they will not be able to do it. And also there are abnormal behavioral characteristics found in these kids, mannerisms like stereotype behaviors like head banging. They'll be banging their head often just to get things done. So body spinning, they'll be just spinning the body like that, hand flicking, moving their hands like that, moving their fingers, clapping, and so on. And ritualistic and compulsive behavior, they will be repeating their behaviors as such. And they will not be very much receptive to any change. There is this resistance to even the slightest change in the environment. They will not be able to adapt to any change. And they are found to be very much attached to inanimate objects, or that is they will have their fond of aspects like kind of toys and so on. Hyperkinesis is all commonly associated, which means that they are like people with more movements, fast movements. They cannot be in a particular place as such. And they are also found to have mental retardation, and only about 25% of all autistic children have an IQ of more than 70. More than 50% of these children have moderate to profound level of mental retardation. So other features, as I had told you previously, they enjoy music particularly. They are also, previously it was known as idiot savant syndrome. Now it is known as autistic savant syndrome, which means that though they are not very functional in many aspects, certain islets, okay, of certain functions will be very much extraordinarily super in those children. For instance, these children are some might be very much fond of horse riding. Some kids will be really very much interested in garden. Some children will be really very much interested in music, and they will be, their talent in those field of their choice will be extraordinarily superb. Epilepsy is also found to be really very common even this type of children with IQ less than 50. Next, we are going to move on to another type of disorder, which is very much predominant among the children, which is otherwise called as attention deficit disorder. It can be classified into 4 types, which is with hyperactivity, without hyperactivity, residual type, and with contact disorder. We will see one by one. So here the children with hyperactivity, they have this poor attention span with distractions. They will not be able to finish the things that they have started. They will become all the time shifting from one aspect to another aspect. They will not be bothered to listen at all. They are the children with like easily distracted, and often they lose things as such. They will just mislocate the aspects. Okay, next comes ADHD, attention deficit hyperactive disorder. They are found to be having with a very hyperactiveness, fidgetity, which means like they will not be able to sit in one place as such. And they will be, they are found to be talkative and very much action oriented. They will be people not think, but very much moving very faster, and they cannot wait. They cannot wait for their turn. There'll be some kind of people we would have seen in our, even in our classes, right? Some enthusiastic people, they cannot wait for their turn, but immediately they want to quickly just come out of their what they wanted to say and intend to do. And there are also conditions where which ADHD without hyperactivity, where they will have similar features as the higher people's children with hyperactiveness, but with other than this hyperactiveness, the common features will be the same as such. Next is the residual type, in which the patient with the past history of ADD and precedence of some kind of aspects even that would last in the adulthood. Hyperkinetic disorder with conduct disorder, where which these children will have a problem in the conduct of their everyday activities as such. So what is conduct disorders? It is characterized by persistent and significant pattern of conduct, where which they will be the people who will be violating the rules. Okay, and we would have seen children, and even in the introduction, Reshma had also read saying that I'm a part of a project where I'm studying the rehabilitation aspects of children who had been rehabilitated from the special homes after they had been found doing some offense. So these children have this conduct disorder. They will not be very much obedient to the laws or the rules. So they will be found to be frequently lying, stealing or robbery, running away from schools or homes, and they will also be involving themselves in violence like rape or setting fire, assault. It is like a sudden attack to anyone, and or they are found to be very cruel to animals and people. And these are all this is another aspect tics, which is an involuntary movement which occurs suddenly, repetitively, rapidly, and with no process, with no purpose as such. So it is also otherwise called as Tourette syndrome. Children are affected with this type of syndrome. They are having two types of syndrome, that is the motor tics and the vocal tics. Motor tics is nothing but the movements. So they will be having you would have seen children or like even adults, they'll be blinking their eyes often, so and shrugging of shoulders, they'll be moving their shoulders like this often, right? So that is a part of the Tourette syndrome. And their facial gestures, sometimes they will be just frowning their face often, right? And they some people, some children also found to be very jumping. They cannot stand one place as such. And these are all related to the motor tics. Now coming to the vocal tics, that is the related to the voice as such. It can be further divided into two types, that is a simple and a complex. In simple, now they are found to be coughing. And though there is no kind of physical condition, but still they'll be all the time found to be coughing. They'll be clearing the throat often when they are talking. Okay, often with no reasons. And echolalia is nothing but they'll be just talking repetitive words as such. They'll be all the time talking repetitive words during the conversation. For instance, they might say yes, like, you would have seen such people, right? So this is a condition which are often found in children, non-organic ureasis and non-organic encopresis. It is nothing but non-organic ureasis is nothing but repetitive voiding of urine either during the day, even after attaining that age of understanding. You have to go for even understanding of toilet training. Encopresis is nothing but even after attaining the age of toilet training, but still they have a kind of a consistent fecal continences. So this is found between the age of 4 and 8. So all these aspects are found in children which have to be treated. There are also other speech disorders which causes disability among children. So that is the stuttering disorder of speech, where which it is characterized by disturbed fluency. People will have kind of a stammering, right? So there is an intermittent block and a repetition of words is there, prolongation of sounds. For instance, if I wanted to talk like if I want to say amma, I will be saying like that prolongation of sounds and repetition of words, repetition of syllabi. For instance, like if I want to say talk, I will be saying tut 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 talk. So such kind of disorders are found in children, and all these are all associated with anxiety or distress that the child had encountered in their early life. Next comes your habit disorders. This is again a stereotype disorders which are intentionally and repetitively produced, but it is very not very constructive, and it is not very socially acceptable function. So you would have seen the children, even adults, nail biting, head banging, thumb sucking are all examples of such people. So other disorders includes anxiety disorders, phobic anxiety disorder of children, that is like fears of group, of stage, and so on. Social anxiety disorder of childhood is also found to be very common among children, where which they will not be very comfortable in groups and gatherings as such. So having learned all these disabilities, now I'm going to focus on the main aspect, that is the causes of disabilities, which can be divided into three aspects, that is prenatal, natal, and postnatal. So prenatal is nothing but during the time of pregnancy, what all might be the reasons for these disabilities. It can be the chromosomal disorders, it can be because of the single gene disorders, okay, it can be because of also the adverse materials, that is you're not taking the proper nutrition, and also because if the mother or the father is an alcohol, okay, that might also maybe the reason of causing a disability in the child. And environmental influences might also be the reason. So for instance, like if a child is like or like if the mother is all the time exposed to radiations, that is why we say that do not keep your cell phones nearer to your head, do not talk during your cell phone is charged, and so on, right? So there are continuous radiations that is transmitted, so it is highly very much serious to take care of the pregnant mothers during their time of pregnancy. Next comes the natal, that is during the times of pregnancy, third trimester, that is during the time of delivery, and the first few weeks of the life after the birth. Okay, so if the mother is having any complication such as the kidney or heart disease, or even the diabetes or the placental dysfunction, that might also cause the disability among the children. Or if the mother or the child, if there is any complication, that is the perinatal during the delivery time, severe prematurity, if the baby is found to be very low in weight, or like birth asphyxia, which means like difficulty in the breathing, all these might also result in a permanent disability among the kids. And children who are suffering from jaundice, hypoglycemia, and the first few weeks are also very much seriously to be considered, because that might also induce problem. Okay, postnatal brain infections such as TB, Japanese encephalitis, bacterial meningitis, head injury, and chronic lead exposure, malnutrition, cross understimulation will all cause permanent disabilities among the children. So it is highly imperative for any individual to take care of the mothers, right? Especially from the time of conception during even till adolescent of the child. Okay, so it is highly essential to take care of the child along with the mother. And so continuous checkup is very much mandate now. Then the Ministry of Mother and Child Health Ministry Development is very much looking forward in treating the mothers there, so that there is no home deliveries. When we go to rural areas, still we are able to see home deliveries that is happening. So students like you, young generation, are now in the position to educate all the people in and around you to take care of, so that there is no disabilities in the future. Yes. So when these children are not taken care of, definitely there is an oral language development, the deficit in the memory skills, difficulty in learning social rules, and they will not be very much great in solving their own problems, and they are found to be not very adaptive, and they are found to be not very taking care of themselves. Self-help is also not very possible. So what any children below IQ, it has to be tested and they have to be trained. Okay, now because all these symptoms are very much evident among children before they reach their age of 18. So it is highly imperative for you to monitor the developments of the child from day one as such. uh, Management of mental retardation and also any other disabilities begins with breaking the news to the parents of the affected children sensitively. It is not a very easy job for any individual to just to saying that your child is going to be like this lifelong. So that would definitely affect them psychologically. They might in all realms of the life, right? So you should be really now, as an educator, as a person, if you are a part of the healthcare team, it is highly essential for you to break the news very sensitively, but with compassionately and also culturally appropriately. You are now in Chennai. Now you know what exactly is the scenario here. But when you move on to other places, we should also be really very much aware of like how you are going to disclose these kind of information to the family members. By most definition, we all know mental retardation, there is no cure, but appropriate support and teaching will definitely help these children to do many aspects. So what are some of the concerns of these children as such? So we all have seen these children are having problems in accessibility. So during my beginning of my session, I had asked you people, how well are our society really very much helping the children, mainly the disabled children now to access the functionalities. Every day I travel, I use the public transport or the train, but I always have the burden. How disabled friendly are our transport system? How disabled friendly are our road? Okay, all aspects, it is not that disabled friendly. If you had seen or if you had visited the National Institute for Empowerment of Persons with Multiple Disabilities, NEPMED, there you could see how disabled friendly that campus is very well maintained. That is the first disabled friendly campus all over the world. So it has also received many awards. So accessibility is found to be a major concern among these people. Because of their inaccessibility, they are not able to be part of the environment or to the society as such. Moving on to the next aspect, education. Studies have mentioned saying that 75% of children have been dropped out from their education just because of not accessible and also not very acceptable by the fellow mates. So it is our main duty to educate all the people in and around us so that all the children who with ability, without ability, should definitely have the access to education. And many of the children are very much suffering because of the myths and stereotypes. If any families have a child with any form of disability, that family member are like very much stereotyped because of something they had done. Because of that only this has happened, right? So all these children, if my child is working with those children, definitely my child will also get such kind of habits. So the generally the parents are not very much willing to put the children in inclusive educational institutions, because they always fear that my child will also acquire all these maladaptive behavior, because of which they are very much stereotyped. They also have a feeling of being ignored. They do not, they are I have personally have seen, when we go for field visit, all the children, all the family members in the household will be talking to us, where which they will completely ignore a person with disability in the family. They will say, that girl, she is good for nothing, she cannot do anything. So likewise, they will be just ignored of every other family members. Because of that, they are not able to progress, they are not able to develop on themselves. And next is the lack of employment. We all know that there are legislations, there are provisions for people with disabilities to move on, but still they are not getting their own employment because of the previous said aspects. If no access, if no education, because of the stigmatizing, definitely you would have not acquired all the necessary skills for an employment, right? So all these have their own connections, which is going to affect the self-esteem of the child, and which in turn is going to affect not only the present condition of the child, but also the future aspect. And feeling of being incompetent is always there among these children. So it is highly essential for us to include them in all our activities. So talk to them, include them in your decisions, in discussions. So make them feel that they are also very much competent enough. We all know that there are Olympics especially for these children. There are also institutions which are taking care of them, but still many of the children in the rural places, because the statistics says that 60% of the disabled children are not in the urban areas, but in rural areas, where which they are just ignored. They are not able to access all these privileges which the government and the non-governmental organizations is offering. And they are also found to be really very much teased and abused by many of the, that is, bullying is very common aspect among these people. They will just put the names, they will just call them by names, okay, which will definitely hurt them. And also abuse is a very major criteria. It is not only for disabled children, even for children who are supposed to be really very normal and not thing, but still they are like under many abuses which we are reading in, even in our everyday newspapers, right? One visit to a place near Chennai, we were able to find a child. She was about 14 years old, but she was found to be very frequently assaulted sexually. And the mother, because of the poverty, she has to go for work, and there will be no one at home. Because of that condition, she was abused very badly, many a times assaulted. So we had to take care of them. We had referred that child to the organization which had taken us to the field work, and this child was put in a the institution where the child was very safe after which. So it is highly essential, it is a very concern from a person of with disability, that they are all the time, many a times, are abused and bullied, and they are very much patronized, saying that these children, they cannot definitely be really very much productive to the society. What is the need of them? All these are all the said aspects by the society people. And there, because of all the aspects, because of no access, because of no deprivation of education, because of all the stigmatization, because of all these bullying aspect and patronization, they are also found to have no relationship. That is like they do not find anyone who is like very much fond of them, or like who will offer an empathetic concern over them. So all these are all the concerns which I had also taken from an organization which exclusively working for the children. So these are all not just a theory, it is all the practical experiences of these children, particularly the children with many disabilities. So the mainstay of treatment of disability is developing a comprehensive management plan. Okay, this is possible only not with one particular team, but with multiple disciplines, including the special educators, language therapists, behavioral therapists, occupational therapists, community services, the nutritionist, dietitians are very much essential, the social workers, and also the family members to take care of the disabled children. So, having said all these concerns, are they prone to all these aspects? Don't they have any rights? They do have rights. There are many rights that are exclusively written in the legislation of Rights of Persons with Disabilities Act 2018 in Chapter 2. These are all the said rights of the persons with disabilities: equality and non-discrimination. Any person with disabilities are entitled to all these rights. They have to be treated equally. They should not be discriminated on any grounds as such. And the children and women with disabilities have to be protected. Okay, so they should not be ill-treated. They should not be insulted, and they have all the rights to have a community living with a very kind of with any other people as such. They can lead a very happy community life as such, so that there is no problem. So they are also able to access the resources. They have the rights to protect themselves from cruelty and inhuman treatment. They also have to be protected from the abuse, violation, and exploitation. So it is the state's responsibility, not only the government, but all the individual inside the state, that they have to protect any child from all these abuse, violations, exploitations, and they have to be protected and they have to be safeguarded. Their home and family should be a safe place for them. And these people with disabilities also have their own rights to have the children or not to have the children. They have the rights to vote. They have the rights to access to the votes. They have the access to justice. They have the right to have the legal capacity. They have the right to provision of any guardianship, if at all, if they need any places. That's what we will say even in reservations. Even while traveling, we have a provision from the central government side saying that there is a kind of a leverage or concession for people with disabilities, right? We have one compartment generally exclusively for these people, and they have also can designate authorities to support them. These are all the main rights of the people with disabilities, which you have to know now, where which like you can also claim, if at all, if it is not done for the people. Having said all these, what are our responsibilities as individuals? So I would like to divide it into three aspects. Number one, as primary, secondary, and tertiary. At primary level, what we can do is like we can improve the socio-economic condition of the society at large, aiming at eliminating understimulation, malnutrition, prematurity, and perinatal factors, which we all have heard previously. Okay, you might say, ma'am, I'm just a student. How well am I going to do this? Okay, so I would like to substantiate with a story, right? So there was a painter. Are you all listening? Can I have a S from your side in the chat box? Oh, great. Oh, great. Super. Yeah. Okay, thanks for that. Yeah. Okay, I'm overwhelmed. Okay, thank you. Thank you for your immediate super response. Okay. Oh, ma'am, Flunera, all these while whatever you had spoken is not going into my head, but at least I would like to concentrate is the message for you all now. Okay, there was a painter where which he was given a task to paint the boat of a owner. Okay, the boat owner had given the task to a painter saying that you have to paint my boat. And the painter started working, and it was he painted the boat with a very colorful paint. Okay, and it was bright colors, maybe red or yellow or something like that. Okay, so it was beautifully painted. While painting, he accidentally he also saw that there is a kind of a hole in the boat, a very small hole. So he saw that, and he just repaired it, and he just continued his work, and he finished it off. Okay, and after a while, after 2 days, the owner came and he saw the boat, the painter, and he just offered him a check, okay, with a lot of money in it, a value of so much of money. Okay, this painter was very confused, like, what did I do, sir? Like, you had paid already. Okay, for the painting charges you had paid. Why this extra money? So he didn't know that. The boat owner was very excited. He said, no, 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 even this money is not sufficient for you. I said, like, how come? Please explain to me. I'm not able to understand what you're trying to say. The painter said. So the owner again repetitively, he said, like, you know one thing, I forgot to inform you that there is a hole, okay, in the boat, and I also forgot all everything, and I just left the boat after the paint. I left home, and I did not inform my family members. You know what happened after the day you painted? No, my children was very much interested to go for a boat ride. They all went for the boat ride, and when I knew that my boat was not on the shore and my children was missing, you know how much bad as a father, I would be very much agitated. I was very much anxious enough, and after a while, to my rescue, all my children returned back safely, and I quickly looked into the hole where it was, and I couldn't see that. And then after which only I understood that it was you who had rectified it. So, you know, as a father, you had saved all my children. So this small act of you, a very small, had saved all my family members. So this money is not going to be very sufficient. So likewise, dear children, I'm here to tell you, you might not be the change makers at a larger level at this point of time, but still, we all know that you're all generally these youngsters, you all will be very much diet conscious people, right? You might not be having so much of food, but at the same time there might be children who will be consuming a lot of junk foods. So my advice and my appeal to you is to have a good nutritious food, so that like there is a proper and a very healthy future generation. Definitely you will be a part of this primary prevention, because if this malnutrition is very much rectified, many of the disabled children will not be there in our society. There will not be any premature babies, premature deaths. There might not be infant mortality rate. There might not be any perinatal factors. Okay, so I invite you all to join this mission. So moving forward, I would like to talk to you about how to educate. You can remove the misconception among the people. You can also educate them to get good perinatal medical care and facilitate. You can also be part of research activities. You can also encourage people to have genetic counseling for people for parents at risk. Generally, if they are very much aged and if they had conceived, and if they are married consanguineous, generally educate them to avoid such marriages and so on. And next is a secondary prevention. If that is not there, early detection and treatment is very much essential, and preventable disorders, so that you will be able to avoid any handicaps in sensory, motor or behavioral areas. And the treatment will definitely will help the people so that there is correction. Early recognition of the presence of mental retardation will also help the children to understand, saying that they will be able to train well. Next comes your tertiary prevention, treatment of psychological and behavioral problems. So there are rehabilitation possible. There are rehabilitation institutions. There are rehabilitation centers, which gives focus on various arenas where which the children are in need of care. Okay, so there are vocational rehabilitation, physical rehabilitation, and also social areas where the children in need. And so there are also parental counseling that is there. So identify that organizations which are very much closer to the children so that they will be able to go. So there are also institutions which take care of the individuals with profound mental retardation. So identify that for the children who are near in your locality so that they will be helped off. And you can also educate the people so that there is avoidance of environmental programs which are you youngsters, you can be all the time very much environment friendly, eco-friendly, so that there is a reduction of exposure to lead, mercury, and other toxins and radiations. So, and also you can increase your public awareness to the risk of alcohols and drugs during pregnancy, which will definitely reduce the incidence of retardation and disabilities. Okay, so now I guess I had done a lot of orientations to you. So now here is a small clip. So if at all, if you have an apprehension saying that, ma'am, how a normal person will be able to do, here is a person who I want to introduce to you all during this session, how this person had made a difference in the among the people who are disabled. Kindly let me know if it is audible or not. Is it audible?
No.
Now?
No, ma'am.
No. Okay.
So
Is it okay now?
changing the whole world toward
Yes, ma'am.
Helen Adams Keller was born with full sight and hearing on June 27, 1880 in Tuscumbia, Alabama. Yet at 19 months, she was stricken with what at the time was called brain fever and was left both blind and deaf.
Helen was a very privileged little girl. Her parents were quite wealthy, and her mother in particular was very intelligent and very well read. And she contacted the Perkins School for the Blind and managed to get help in the form of Anne Sullivan Macy, the now very famous teacher of Helen Keller.
Anne Sullivan began working with fingerspelling and other ways of trying to communicate with very little success until one moment, the aha moment came. It hit Anne to take Helen out to the water pump, and she hand pumped the water and let the cold water flow through Helen. Helen's one hand, while she fingerspelled W-A-T-E-R in the other hand. Everything just came together for Helen and for Anne. And all of a sudden, the behavioral problems disappeared, and they started fingerspelling. They managed to develop 30 different new words by the end of that first day. They were on their way.
By age 10, Helen Keller had mastered Braille as well as the manual alphabet. She also learned to use a typewriter. By age 16, Keller could speak well enough to go to preparatory school. And by age 24, she had graduated from Radcliffe College cum laude.
She's the first deafblind person to graduate from a college. She graduated in 1904. Anne Sullivan Macy, her brilliant teacher, had to manually sign every single lesson into her hand.
When Helen was still in college, she wrote her first book, her biography. From that, she began writing other articles and speaking. And because of her deafblindness, people would pay attention in a way that they didn't to other people, perhaps. And she used that to advocate for not just disability issues, but political and social issues, including women's suffrage, birth control, and other issues as well.
Helen Keller was famous from the age of 8, but her celebrity increased as she championed the cause of those with disabilities internationally.
During the 1930s, 40s, and 50s, she traveled the world, 39 countries, bringing hope and courage to millions of people. She changed the perception of people with vision loss. Rehabilitation centers and schools for the blind were established because of her visits.
In the late 50s and early 60s, Helen's life story was brought to the masses with The Miracle Worker, first as a TV movie, then a Broadway show, and finally an Oscar-winning movie.
She knew everybody from Alexander Graham Bell to Lyndon B. Johnson, and she was brilliant at leveraging all the people that she knew for help to change the lives of those with vision loss.
Helen Keller lobbied on behalf of the American Federation for the Blind for 44 years. She died in her sleep on June 1st, 1968, just weeks away from her 88th birthday.
Helen Keller will be remembered for really transforming the view of the blind and others with disabilities. Prior to her life, people with disabilities were seen as people who did not deserve to live full lives. And Helen Keller's activism, her life story, really challenged the stereotype and said that people with disabilities can live a full and complete life.
Yeah. Yes, alone we can do little, but together we can do much, is the words of Helen Keller. Thank you so much for the opportunity. If you have any questions or queries, you can ask now.
Thank you, ma'am. It was really a knowledgeable session. Girls, if you have any questions, you can post the questions in the chat box. So, ma'am, I have a question. Is there any ways to avoid causes of mental retardation, like to avoid or to prevent?
Yeah, there are prevention that is possible. The one is like antenatal care is very much important, right? So that is what the government is also trying through the Ministry of Women and Child Development. They are very much focusing on the reproductive health of the mothers. So what I would suggest is, like, from the young age, you all have to have good folic acid supplementations, iron tablets, so that your nutrition level is really very high. And this mental retardation can be prevented when you have a good antenatal care. Mainly, there are many reasons. One way of prevention is a good antenatal care. Yeah.
Thank you, ma'am.
Thank you. Yeah. The differences between ADHD is hyperactive disorder and ADD is attention deficit disorder, where which only the difference will be hyperactiveness will not be missing in ADD, and hyperactiveness will be there in ADHD. Thank you. I have seen people, even elderly people, right? That is the adults. From the childhood, they would have had this ADHD, but now they are progressing well and they are leading a very normal life. And I have been part of one seminar as such, where which they were able to do very well. They are employed and so on. So these ADHD, though it is a concern, if it is correctly treated, definitely the change is possible. Yes, Priyadarshini. The role of the mental health professionals among the children is to mainly for prevention, which definitely comprises of the education, awareness. Okay, and you have to repeatedly tell. Now we all are hearing repeatedly the ringtone, right? Every day, whenever you switch on your mobile and call somebody in the first time, you're talking, you're hearing about I'm sorry, COVID-19 precautions, right? So likewise, continuous education, spreading awareness is very much essential, so that definitely you'll be able to prevent any forms of disabilities. And there are disabilities which might happen in the life course time. For instance, locomotor disability, or like when we age, now visual impairment is also, that is normal course of life. But preventable disabilities can be done mainly through education and awareness. Yes, Soundarya Lakshmi, this calculator, yes, they will not be, they will be really very much good in maths. They cannot even do a simple calculations. So that is known as this calculator. And they not like in India we are given subjects like which like they have to take all the other subjects, but in abroad there are there are freedom for children to choose any subjects not involving mathematics or digits. Likewise, we can also train them in doing such, opting for such subjects. Or the children with ADHD who are slow, are that no? See, hyperactiveness is one of the symptoms that is very much predominant in those children. So hyperactiveness is movements, fast movements. So maybe the children with ADD, attention deficit disorder, might have no, they might be very, they might be slow, but not ADHD. Yes, yes, yeah. Down syndrome, yes, fine. But what you can do, it's not about the food, a nutritious food with all the proteins. Yes, fine, it is good. At the same time, what you have to do is like you have to educate them with certain aspects, like how well they can develop. Okay. For instance, like with whatever skills they have, first of all, you have to identify what exactly are the skills that they are able to do, and help them to excel in those skills. That would be really very great. There are also institutions where which you can go and help them so that they will be improving their functional skills as such.
Ma'am, there is a question like, is there any specific time period to cure autism?
It is a condition. So it is a condition which many times is not possible for curing. But at the same time, you can take care of the child and you can all the time help them to move in a way which are very much interested. For instance, as I had told you, even in my session, one child was very much interested in gardening. So what you could do is like helping the child to focus on the gardening aspect, which the child will be really very much excelling in doing that. So that would help the child to function as a normal kid. But otherwise, treatment is there, but curation not much.
Thank you, ma'am. Ma'am, one more question. Is there any ways to prevent genetic causes for the disabilities?
Genetic causes is inherent, right? Now there are prevention, there are counseling, and there are advanced technology. For that, you have to go to a medical practitioners for counseling, and genetics is inherent, right? So alternatives would be suggested by those medical professionals.
Okay, ma'am.
Okay, what would be the almost utmost role of parents of children with affected with disability? First of all, one thing you all have to understand is that any family with a child with lesser functional is very difficult, right? So first of all, you should help the family members to uh, develop a confidence in treating that definitely I'll be able to cater to the needs of my child who is with special needs to the fullest. So that confidence level has to be built in among the parents, number one, and you have to educate the parents that it is not your fault. So sometimes they might be having all the many situations, they might having a guilt feeling, maybe because of me. So that you have to heal them from their guilt, and you have to help them to move forward how best they can do it. There are institutions, you have to schools, especially for autistic children. There are spastic institutions, in Taramani is also there, NIPMED is there. So they're all offering education at various level, giving individual attention to the children with disabilities so that they will be developed, they will be reaching the optimal level of functioning. So that would be the role of the parents. I guess like I had answered this preventing genetic disorder. Yes, you have to consult the medical professionals on the way.
Thank you, ma'am.
Thank you.
No matter what language you speak, a kind and smiling thank you always sticks to everyone's heart. Now, I welcome Ms. Akshay of 2nd MSW to deliver vote of thanks.
Good afternoon to one and all present here. Honorable Resource Person Dr. S. Rachel, Principal Ma'am, Vice Principal Ma'am, Mrs. Esther Vinci, Head in Charge, Mrs. Helen Diana Ma'am, Assistant Professor, Mrs. Aruna Abhirami Ma'am, Assistant Professor, and Ms. Priyadashni Ma'am, Assistant Professor, and all my fellow mates and participants. It is such a honor for me to get the opportunity to thank all the dignitaries. On behalf of the MSW Department of SDNB Vaishnav College, I extend my gratitude to all the people in the gathering. I would like to express my thankfulness to all the esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Resource Person, Dr. S. Rachel, who has spared time from a busy schedule to grace this event. Thank you for sharing your knowledge and thoughts about child mental health, mental retardation, different grades of IQ, and causes of disability, and the rights of the person with disability. We all make sure that we follow a good and proper diet. Thank you, ma'am. I extend my gratefulness to Mrs. Esther Vinci, ma'am, who head in charge of MSW department, who has organized this webinar. Thank you, ma'am. I would like to thank all the participants for their active participation. Once again, thank you all.
Thank you, Ms. Akshaya. Once again, thank you, ma'am. And also, I thank the participants who were patiently listening to this great session. Thank you all. Girls,
you.
the feedback,
Thank you all.
has been posted, so you can.
Participants will get their certificates after 1 week. Thank you.